A 55-year-old man presents with several months of difficulty achieving erections. Further examination reveals vascular disease affecting one of the branches of the internal iliac artery. Which of the following structures is most likely also affected in this patient's condition? Choice A, gluteus medius muscle. Choice B, gluteus maximus muscle. Choice C, rectum. Choice D, testes. Or choice E, psoas major muscle. I'll wait 5 seconds and answer the question. When USMLE questions ask about sexual function, especially difficulty achieving or maintaining erections, obviously you'll be thinking about the etiology. Obviously, there's stuff like psychogenic and neurologic causes, as well as potentially hormonal causes. But in this particular case, I straight up give it to you that there's a vascular problem. Now, a lot of times when you think about problems with sexual function, especially achieving erections, and they talk about vascular problems, you want to be thinking internal pudendal artery, which is a branch of the internal iliac artery, which has several branches in the pelvic area, such as the perineum. It has a perineal branch, it has posterior labial slash scrotal branch, and dorsal artery of the clitoris slash penis, as well as the deep artery of the clitoris slash penis. The internal pudendal artery also branches to the inferior rectal artery, which supplies the lower rectum and the anal canal. So choice C, rectum, is the correct answer. Now, even if you don't remember that the internal pudendal artery also branches to the inferior rectal artery, all the other answer choices here are actually also pretty high yield in terms of their arterial supply. So let's just go through them. Choice A, gluteus medius muscle. You want to know that the gluteus medius and the gluteus minimus muscles are primarily supplied by the superior gluteal artery, which actually also branches off the internal iliac artery. You want to contrast that with choice B, gluteus maximus muscle, which is supplied by the inferior gluteal artery, which also branches off the internal iliac artery. Knowing which gluteal artery goes to which gluteal muscle is something that has come up a couple times on MBME questions, so you really do want to know that. It's one of those things that some students get wrong because they think gluteus maximus is bigger, so maybe it's the superior branch, but that's wrong. It's actually the inferior gluteal artery that goes to the gluteus maximus, and the superior gluteal artery goes to the medius and the minimus. So you do want to remember that. Choice D, testes. This is actually the furthest answer away from all the other answer choices because this isn't even from a branch of the internal iliac artery. The testicular or ovarian arteries in women directly branch off the abdominal aorta. And obviously, there's some stuff they like testing on, like the testicular slash ovarian arteries, right? For example, they like testing you on water under the bridge where the ureters go under the testicular slash ovarian arteries. Of course, they also like testing on the fact that the suspensory ligament is the ligament that contains the ovarian arteries in women. Anyway, like I said, this is the furthest artery away from the other answer choices, but it does get tested fairly often for a couple details. Choice E, psoas major muscle. This is primarily supplied by the lumbar branch, the iliolumbar artery, which is also a branch of the internal iliac artery. Not as important as the other answer choices, but you do want to be aware of the blood supply and innervation for the psoas major muscle. Like I said, lumbar branch of the iliolumbar artery for blood, and its innervation is the lumbar plexus L1 to L3. So zooming out from these answer choices a bit, you'll notice that a lot of these are branches of the internal iliac artery because they do like testing on a number of branches of the internal iliac because the pelvic cavity is a pretty busy spot in the body. So you do get a fair number of anatomy questions from that region. Like I said here, the gluteal arteries are tested fairly often. Internal pudendal artery is also pretty important. As I mentioned, the inferior rectal artery branches off of the internal pudendal artery, which branches off the internal iliac artery. But you also want to know that the internal iliac artery also branches off into the middle rectal artery. You also want to know that a couple of the vesical arteries, which supply the bladder, also come from the internal iliac artery. And the obturator artery, which also branches from the internal iliac, also has come up a couple times. And of course, you want to know that the obturator artery supplies the inner thigh and the obturator externus muscle. There's a lot of anatomy we could go through, but once again, the internal pudendal artery is pretty important and has come up quite a few times. Supplies the external genitalia as well as the inferior rectal artery. I hope you found this video helpful. I'll see you in the next one.